Hi, my name is Kelly Knight. I will be hosting this video presentation for the Medication Administration curriculum. This course aid was designed to review with staff how to safely administer medications in settings authorized by law. These facilities and programs include personal care boarding homes, adult foster care facilities, alternative care facilities, residential child care facilities, secure residential treatment centers, residential facilities that provide treatment for mentally ill persons, services and support of persons with developmental disabilities funded and regulated by the Department of Human Services, and state-certified adult day programs. This video provides information on how to administer medications according to written physician orders, maintain proper documentation of the administration of both prescription and non-prescription drugs, and safely and accurately fill and administer medications to and from the medication reminder boxes with oversight from a licensed person or a qualified manager. There must be a written, signed physician's order for each prescription and non-prescription medication. There are 6 parts to a medication order. The first is the client's full name, then the date of the order, the name of the medication, the dosage, and the route, and finally the doctor's signature. It is important and necessary to translate written doctor's orders containing medical abbreviations into everyday terms. This list includes some of the most frequently used medication abbreviations. Each medication given to a client from the original container or from the medication reminder box must be charted on the medication administration record. The qualified medication administration person who personally administered the medication should record and initial each medication given in ink as soon as possible after the medication is administered. When starting a new medication administration record, it is important to copy only from the physician order and not from the original medication administration record sheet. Initial only the medications that have been personally administered. If a charting mistake occurs, draw a single line through the mistaken entry and initial and date the error. If the medication cannot be administered or a client refuses a medication, then initial the appropriate box. Circle the initials, provide an explanation on the back of the form, and contact the appropriate person. Draw one line through discontinued medications and highlight with a transparent marker. Then draw a line through the remaining boxes for the month. Each facility that chooses to use medication reminder boxes will be responsible for developing, implementing, monitoring, and enforcing the policies and procedures used in filling the medication reminder boxes. Medication reminder boxes must have a complete label including the name of the client, the name of each medication, both prescription and non-prescription, the dosage, the route, and the time that each medication is to be administered. The qualified medication administration person must take the following steps when checking the medication reminder boxes. First, Compare the medication administration record to the physician's order. Then compare the medication administration record to the label on the medication reminder box. And finally, compare the medication reminder box to the label on the medication bottle. Medication reminder boxes should be filled in a safe, quiet, secured area free of interruptions from staff, clients, and telephone. Check medication reminder boxes prior to filling for cleanliness and good repair. Wash hands before filling medication reminder boxes. Only oral medications can be placed in the med reminder box. Do not handle pills with fingers. Disposable gloves or rounded tweezers may be used to transfer medications one at a time from the bottle lid to the medication reminder box. Fill only one medication reminder box at a time, and regulations prohibit filling reminder boxes for more than 2 weeks at a time. After filling, compare the number of medications that have been transferred to the medication reminder box to the medication reminder box's label. Medications that must be administered according to special instructions, such as PRN medications, should not be placed in the medication reminder box. It is important to know the 6 rights of medication administration: the right client, the right time, the right medication, the right dosage, the right route, and the right documentation. There are standard procedures to follow in order to safely administer medications to clients. After you have read and compared the physician's order, the medication container, and the medication administration record, then gather the items that are necessary for the types of medications that are going to be administered. Next, wash your hands. It is the single most important measure to prevent the spread of infection. Carefully read the medication container label 3 times as an extra precaution to assure that the right medication is being administered. This should be done when removing the medication from the storage area, when pouring the medication from the container to the medicine lid or cup, and when returning the medication to the storage area. Identify and verify the right client. Then take the time to explain the administration procedure to the client. After administering the medication, dispose of any used material and return the items to the storage area. Finally, document and sign the medication administration record. For each type of medication, there are steps that need to be followed in order to safely administer the medication to the client. Medication can be administered through a variety of routes. These routes include ingestion, application, inhalation, and insertion. To avoid handling the medication, pour the tablets or capsules into the lid of the container and then drop the medication into the medicine cup. Instruct the client that the lozenges are not to be swallowed but are to dissolve in the mouth. These medications should be given last after other oral medications, and liquids should be avoided until the medication has completely dissolved. As with lozenges, sublingual tablets are not to be swallowed. Liquids should be avoided until the medication has completely dissolved. And these medications should be administered last. Whereas lozenges may be placed anywhere in the mouth, sublingual tablets are to be placed under the tongue in the front part of the mouth. Check to see that the cap of the bottle is on securely. Read the instructions on the container to determine if the contents are to be shaken, as with suspensions. If necessary, use a rotating wrist movement to ensure a more thorough mix. Next, remove the container's cap and place it with the open side up. Hold the bottle with the label towards the palm of the hand to avoid soiling the label. Then locate the markings on the medication cup from the amount of medication to be poured. Pour the medication at eye level. Finally, clean the lip of the bottle with a disposable towel and securely recap the bottle with the lid. Gloves must be worn whenever coming into contact with medication for a client's skin. Directions for the application of the medication should be a part of the physician's order or included with the instructions accompanying the medication. Ointments and lotions are applied directly to the skin for their antiseptic and/or astringent effects. Liniments are rubbed into the skin quite vigorously to relieve soreness of the muscles and joints. Aerosols are sprayed onto the skin. Not touching the skin has advantages when the skin is irritated or burned. Gargles are solutions that are bubbled in the throat by keeping the solution in the upper throat, tilting the head back, and exhaling air to create bubbling. Transdermal patches, when applied to the skin, release a continuous and controlled dosage of medication over a specified time period. As with other medications, gloves must be worn when applying and removing the patches. If changing a patch, remove the old patch and wash the client's skin with soap and water at the new and old locations. It is important to rotate location sites to avoid skin irritation. To apply, peel off the back of the patch and press firmly onto the skin to assure adherence. To apply these types of medications, assist the client in sitting or lying down or tilt their head back. It is important to cleanse the eyes. This requires a clean tissue, clean wet washcloth, or a cotton ball. Always cleanse from the inside of the eye to the outside. Use a clean tissue or cotton ball for each wipe. When applying eye ointment, start by instructing the client to look upward toward the top of their head. Retract the lower lid and approach the eye from out of the field of vision. Take special care to avoid contact with the eye and apply the ointment in a thin ribbon inside the lower lid. Applying eye drops is much the same as applying eye ointments. Begin with instructing the client to look upward toward the top of their head. Retract the lower lid and approach the eye from out of the field of vision. It may be necessary to separate the eyelids. With care to avoid contact with the eye, apply the ordered dosage of eye drops to the center of the lower lid. Do not allow the drop to fall more than 1 inch before it contacts the lid. If the client is lying down, make sure that the surface is flat and their head is to the opposite side. A client in the sitting position should have their head tilted sideways until the ear is as horizontal as possible. Clean the external ear canal with a clean tissue or cotton ball. Then hold the ear in such a manner to allow visualization of the ear canal and instill the ordered number of drops without touching the client's external ear with the dropper. If drops are to be instilled in both ears, place a cotton ball in the external portion of the first ear before turning the head to instill drops into the other ear. Instruct the client to lie quietly for a short time to allow the medication to reach the eardrum. Administer the nose drops with the client lying down and their head extended over a pillow. The client may be in the sitting position for nasal sprays. In either case, avoid touching the dropper or the spray nozzle to the client's nose. For nose drops, place the nose dropper just inside the nostril and instill the ordered number of drops. Instruct the client to remain with their head tilted back for a short time. To administer nasal sprays, have the client sniff on the count of 3 as you squeeze the nasal spray. This will help to coordinate the client's sniffing with the application of the medication. Another option is to close one nostril while the spray is administered to the other nostril. Administer the inhalant with the client in a sitting position. Read the instructions on the inhaler to determine if the medication is to be shaken. Remove the mouthpiece cover and hold the dispenser approximately 1 inch from the client's mouth. If a spacer on the dispenser is to be used, it may be placed into the mouth between the teeth. Instruct the client to exhale and on the count of 3 to breathe in deeply as you dispense the medication. Then, if possible, they should hold their breath for 10 seconds before exhaling. Wipe off the mouthpiece or spacer before replacing the mouthpiece cover. For both rectal and vaginal suppositories, remove the protective covering and then place them in a medicine cup. Disposable gloves are to be worn for the insertion of these types of suppositories. When administering rectal suppositories, assist the client to lie down, preferably on their left side. Visualize the anal opening, then lubricate and insert the suppository approximately 3 inches so that it is beyond the internal sphincter muscle of the rectum. Instruct the client to retain the suppository for as long as possible. With vaginal suppositories and creams, start by instructing the client to lie on her back in a frog-like position. Vaginal suppositories are inserted 2 to 3 inches into the vaginal orifice. We hope this video has given you a helpful review of how to safely administer medications. Thank you for watching!